let me disappoint you to start with. There's no magic bullet. And in fact, I was very struck when going through the literature available on what works and what law can actually do, discovering how conflicted, mixed the evidence was. And what I would like to do, therefore, is, given that others before me have excellently presented the legal framework, the tools we had, the new opportunities provided by new protocols having entered into force and so on, try to share with you this perplexity based on the review of what we know that works or does not work. And at the same time confront us, therefore, with certain dilemmas and potential trade-offs in the way we approach the use of legal tools to combat obesity and childhood obesity in particular. Let me start by recalling that there is one very classic way of measuring the effectiveness of legal interventions to combat obesity, and that is to examine how many disability-adjusted life years are saved for which costs across different legal interventions that have been tried or have been suggested. And this is the classic cost-benefit analysis that is proposed when assessing the effectiveness of legal interventions to combat obesity. For example, in this much-discussed report of the McKinsey Global Institute that went through 74 interventions in 18 areas, grouped under 3 headings: education, the environment, the food environment, and personal responsibility. And what this influential report did was to try to assess how much it costed society to intervene in a particular way by banning certain foods, by launching advertising campaigns, by encouraging active transport and so on, and which benefits could accrue in terms of lives saved or disability-adjusted life years saved. And the outcomes of this very systematic study are shown here. Basically, a limited number of interventions are relatively ineffective, but if you bring a number of various tools and interventions together, there is indeed a significant possibility of reducing obesity in a population such as the population of the UK. And, for example, by combining 44 interventions out of the 74 that they reviewed, you could reduce the prevalence of overweight and obesity by 20% in the population of the UK. And that is one main conclusion. Another conclusion is that some interventions are much more cost-effective than others. For example, it is quite expensive to work on active transport, which is down in this column of interventions, because it costs $31,000 per disability-adjusted life year spared or saved, when other interventions are much less costly and can have a much more important effect. Of course, these comparisons may be difficult to make. The evidence is more or less reliable, as shown on the right hand of your screen. The number of blue squares indicates how robust the evidence is for the assessments made, but that gives you a rough idea of the conclusions that are reached. Now, what is striking in this report is, first of all, that it does not address some major tools that many of us, many of you, would have thought could be ranked on the very top of the list. For example, there is no reference to breastfeeding, despite the strong evidence we have as to the impacts of breastfeeding on preventing obesity in later life for the kids benefiting from exclusive breastfeeding for 6 months and continued breastfeeding until they reach the age of 2. Some of the articles providing this evidence are listed here on this slide. I don't have to go through these articles, which are well known probably to many of you, but it is striking to me that the McKinsey Global Institute report is entirely silent about this issue. It's also striking that the report says nothing about the structural causes of obesity. They focus, if you wish, on the end consumer, on the lifestyle choices that could be influenced, nudged, incentivized in particular ways, manipulated, if you wish, or encouraged, but they do not see obesity as a result of society-wide choices, factors. And I will return to this in a second to illustrate why I believe this is important. But then thirdly, there's no discussion in the report about the social acceptability or the political feasibility of particular interventions, despite that legal interventions may be more or less realistic to recommend, depending on how strong the actors will be opposing particular measures, or how, conversely, easy it can be to co-opt certain actors into contributing to these interventions. In other terms, there's no question of political economy raised in this report. Fourth and finally, and this is a point again I will return to later, the interventions studied in this report look at individuals as having to be influenced from the outside by the right mix of legal regulations and economic incentives, without trying to understand how people can be motivated from within to lead healthier lifestyles. And this distinction between extrinsic and intrinsic motivations that is well understood by many social psychologists seems to me extremely important for reasons, again, I shall indicate later. One way to understand obesity is by replacing it within the broader framework which it is a symptom of. And this chart is adapted from a scheme prepared by Mexican scientists who worked on obesity in Mexico. I changed some dimensions of it, but it really comes from them. And it distinguishes the proximal causes, the underlying causes, and the basic causes. Proximal causes essentially are those that are located within the choices of the individual. Underlying causes are mostly located within the family, within the community, within the neighborhood, and the basic causes are society-wide and concern, for example, the introduction of new technologies in the workplace that lead people to spend less energy working. They result from the choices made in agricultural policies and trade policies, leading to a globalization of diets. They result in, or they have their source in the choices made in how to develop cities in a way that does or does not reward or make it easy to walk or to use bicycles. And the blue level, and to a large extent even the green level, if you wish, the intermediate and the basic causes levels, are not explored in the McKinsey Global Institute report. And, for example, there is no word in the McKinsey report about poverty and inequality as explaining certain factors that lead people to have less healthy lifestyles. This is a well-known study that looked at 3,139 counties in the US, and ordering these counties by quintile, depending on the average wealth in these counties. So the richest counties on the left here, the poorest on the right, and of course the prevalence of obesity, as you can expect, is much higher in poor neighborhoods. This of course correlates closely with the prevalence of type 2 diabetes, and it is in part to be explained by the fact that in poor neighborhoods people live more sedentary lifestyles, in part because they don't have parks in which to exercise, because the neighborhoods are less safe for them to walk around, and therefore they stay at home and they watch TV. Right? So that question, how poverty and geographical segregation between poor and wealthier neighborhoods is, again, not an issue that the report discusses. And to close with a final comment on the report, there is nothing about globalization of diets. Yet the title of this conference, if I recall correctly, has trade in it, because one of the hopes of the organizers is to understand how globalization of diets, trade and investment flows have led to higher rates of obesity in various world regions. And although the causality chains are still disputed, there is strong evidence that it has had a major influence, right? Which goes in two directions. First of all, globalization means that for some groups of population in some countries, a larger diversity or greater diversity in diets will be available, right? And for many, this will mean better diets, more balanced, more diverse, particularly for the middle class in developing countries. But there are many negative impacts of globalization that should also be highlighted. First of all, in developing countries, what we find is that as the most nutritious foods are sold on export markets, traveling to high-value OECD consumers, the price of these foods increases in these countries, so that the poorest in these countries may have to shift to less diverse diets, monotonous diets, and that are less nutritious for them. Of course, globalization means also that foods are processed in order to travel long distances and to have long shelf lives. And processing foods means robbing foods from nutrients that are the most useful and the most helpful, so that on average people come to depend more on processed foods that are less nutritious. And finally, globalization also means the development of large-scale, highly mechanized monocultures to produce in bulk raw commodities for global markets, and that has impacts on diets. Diets will be less diverse, will be more processed as a result of shifts in how food is being produced. So we must go beyond the McKinsey Global Institute report, and we must understand that without addressing all these issues, we will not make much progress in identifying the legal tools that can work best. But it is a complex environment, and as I said, as I warned, I don't have a magic bullet. I have more questions than I have answers. But I have one certainty, which is that if we don't understand how the system that we inherit from, how the food systems we inherit from, have become inert and very difficult to reform, we will not make much progress. And one way to make explicit what I want to convey here is by relying on the theory of transition that uses the key term of co-evolution to describe this. What this means is very simple. The choices made concerning technological development, concerning the economy, concerning lifestyles, concerning how societies decide which legislations to adopt, all these choices have co-evolved, have become mutually supportive, so that it's very difficult to address one of these causes of obesity without also addressing all the other factors that conspire to create this obesogenic environment. Let me briefly illustrate this. We've made in the past socio-technical choices by investing in research and development, by investing in infrastructures that essentially transform farmers into producers of raw commodities for the food processing industry. And these are investments that were made with a view to achieving economies of scale, with a view to moving towards a cost food economy that actually is bad for health. But this is supported by economic developments and choices. For example, a deliberate choice not to force agri-food companies to internalize the social costs of the foods that they produce, so that the prices lie to consumers as to these public health costs and social costs that they imply. They are linked to the choice not to seriously address geographical segregation, and as I mentioned, for reasons we could discuss further, poor neighborhoods witness a much higher prevalence of obesity than others, and there's no discussion today on the need to address the interest of the industry in producing processed foods on which they may make profits much more than on fresh, non-processed foods. This is also an economic choice. However, these choices cannot be challenged without also understanding that they correspond to what people want. Because we have no time to cook, we have long commuting times, we have lost our ability to cook. Many of us have forgotten how to cook, fresh foods in particular. And we live in environments in which the social norms do not reward cooking and do not grant eating the central place that for many centuries it has had in our civilization. And finally, all this is especially inert since the dominant economic actors control largely how the policies are set. The policies, in turn, are set in a very sectoralized way, agricultural policies being separate from environmental and from health policies and from social policies. And finally, many of the choices made are made to boost the competitiveness on global markets of the food industry rather than for public health. Right? So all these elements that I've just listed here essentially reinforce each other because they've co-evolved in shaping the industrial food systems that we inherit. So, what to do about this? Well, what I would like to propose is to provoke a debate by asking a few questions about how to order or classify or propose a typology of legal interventions to combat obesity. And there's no one single scale by which we can examine these legal interventions. I would suggest that there are 4 scales or dimensions along which we could classify the different legal interventions that have been proposed or are being tested. First, very classically, we may distinguish between interventions that respect or even enhance the freedom of the individual to make choices, more or less well-informed choices, or interventions that are much more paternalistic in their philosophy. And of course, it is in this debate that the proposal to nudge choices without imposing on consumers certain ways of eating or certain lifestyles, but while recognizing at the same time that the environment cannot be treated as simply neutral and that we can reshape the environment to nudge the right choices, it is along this dimension that nudging is appearing as such an attractive option. And nudging indeed is largely attractive to policymakers because it reconciles different sides of the political spectrum in societies, particularly in the US, where the fear of the paternalistic nanny state is still very strong. And that is largely why the work of Daniel Kahneman in the middle here, social psychologist, of Richard Thaler, the economist, and Carl Sunstein have been so influential. And if you look at how nudging is presented in official documents, it is presented as a sort of compromise solution between the extreme of doing nothing or simply monitoring the situation or eliminating choice entirely. And there's a ladder of interventions, in the middle of which there is guiding choices through changing the default option. That is nudging. And that is, for example, how the nudge unit within the British government presents its specific contribution. And I think it's a very important contribution that we made, and I'm absolutely delighted that Amandine Garde and Alberto Alemano have done so much to study this option, which I think is underexplored in its potential. And yes, if we look at the evidence out there, we see that in many cases, nudging choices has been a very useful, effective legal intervention, legal tool to encourage the right choices. For example, if in restaurants there is one healthy menu that is the main option of the day, making it, if you wish, easy for lazy consumers to make that choice, it will significantly increase the choice for menu options than if the healthy menu is below the list. Similarly, if in schools you provide normal milk to children and they have to ask for chocolate milk instead of the two being presented alongside each other, that will significantly decrease the consumption of chocolate milk. And finally, if you present fruit, for example, at the checkout in cafeterias, or if you present fruit very nicely presented, with small flags on the pineapple and nicely cut melon and so on, it will be chosen much more than if it's just presented in bulk in a less attractive fashion. So nudges work is the very brief conclusion that may be drawn from the experiments that have been made so far as regards the usefulness of nudging. But there is a price to be paid if we want to make nudging the key tool that we use to combat obesity. And I'd like to highlight two potential prices to be paid or trade-offs. First, politically speaking, not logically speaking, but politically speaking, it may be at the cost of more structural interventions that nudging is prioritized. And the best example of this is that the specialists of nudging, particularly Richard Taylor and Gus Sunstein, would dismiss as going beyond nudging and as being paternalistic to change the respective or the relative prices of foods in order to influence the consumer's choices. That is a very clear distinction they made. We become paternalistic in the way we try to influence consumers' choices once it is less easy and cheap to avoid adopting that choice that is considered socially desirable. So nudges are not mandates. Putting the food at eye level counts as a nudge. Banning junk food does not, nor would, however, imposing taxes on sugary drinks, for example. Now, so politically speaking, it may be problematic to renounce a range of interventions that tackle the more structural issues. And indeed, we see today in the EU a number of countries who are trying to move towards the fat tax or the sugary drinks tax in various ways. I don't have time to go through all these examples, but Denmark, Finland, France, Hungary provide examples. My own country, Belgium, has announced it would move towards a sugary drink tax, and the UK shall do the same starting in 2018, if I understand correctly, with a more or less high sugar levy, depending on how much sugar added there is in the drink concerned. But does this work? And should we put hopes in taxing foods high in saturated fats, in sugar and salt, in taxing sugary drinks, for example? Well, my friends, the evidence is really very mixed. We have some studies showing that these taxes can be effective in decreasing consumption, sometimes finding a very strong or high elasticity of demand, for example, for sugary drinks or for energy-rich snacks. Sometimes there's a proportionate relationship that is drawn by some studies. But some authors, based on other experiments, believe that impact on consumption will only take place if the tax is very high, a bit like the kind of tax we have on alcohol or tobacco. Others still highlight that, in fact, what's effective is not the price change, but the message accompanying the public policy consisting in introducing the tax, so that the real thing that counts is the message that goes with the tax, or, if you wish, the symbolic value of the law being adopted. And others still consider that it may be counterproductive to impose a tax. Some authors say, well, actually, if you impose a tax on junk foods, people will spend more time cooking at home, they will have less time for jogging in parks. So they will have less, well, I wonder, they have to check their disclosure of conflicts of interest for these authors, but that is an argument that was made. Another argument that is made is that consumers will actually continue to consuming the, junk foods, but will spend less on healthy foods. That is where they will try to save money in order to be able to afford the more highly priced junk foods. And the evidence, therefore, is mixed, and it's still not clear how effective such taxes can be. Another dilemma we face when we discuss nudging is, that's a real dilemma, is whether it is best to influence people's choices by stealth, if you wish, by not telling them that they are a subject of an experiment, or that their lifestyle is not the right one and that we are trying to change this. Is this the right way of doing things, or should we instead be very explicit about the health message that accompanies the change in policy? It's not very clear what the best approach is. Some authors have suggested that it could be a very interesting and useful and effective intervention to change the composition of convenience foods, junk foods, comfort foods, without people knowing it. And for example, this interesting article published a few years ago, I don't remember the exact date, but was by authors, it was 2013 I think, authors who designed a margherita pizza that was nutritionally balanced, less energy rich than the normal ones you'd find from any pizza outlet. So they have toppings of tomato paste and mozzarella, but then they added ingredients for taste and for nutrient content, so that they had a less calorie-rich pizza that at the same time provided the full range of nutrients that you required. Right? And people actually did not see the difference. They thought it was quite as tasty as their normal pizza. And the argument of these authors is to say, well, actually, if you want to get kids eat more healthily, don't oblige them to change their view about, or their taste, or their view about what eating nicely is. Just do it by changing the composition of what they eat without obliging them to change their habits. And maybe this is the most effective way. In fact, there's a study titled "When Healthy Food Makes You Hungry" that troublingly shows that if people eat something that is presented to them as healthy, as good for remaining slim and healthy, they will actually be hungry after having eaten that, and they will want to compensate by eating things that make them happy. If you don't tell them anything, they will actually feel full and they will not want to compensate. They have nothing to compensate for in their mind. So healthy foods might actually trigger a reaction that may be counterproductive as a result. So these papers would argue in favor of a health by stealth approach, if you wish, right? Where you try to provoke change by not involving people and not informing them about the fact that they need to eat more healthily. Conversely, however, we have studies showing that one key reason why people don't eat healthily, eat junk foods, do not eat enough fruits and vegetables, particularly amongst adolescents, is because they believe all their peers do the same. And this study is interesting. It shows that actually adolescents systematically overestimate how much junk food and sugary drinks other adolescents consume, and they underestimate how positively judged the consumption of fruits and vegetables is by adolescents themselves. So, in other terms, they misrepresent the practices of others as well as the judgment that others have on various diets. In other terms, the message is, if adolescents were better informed about what they actually do and what they actually assess to be a good diet, they would be convinced out of a desire to be aligned with the norms of their peers, they would be eating more healthily. And this is exactly the opposite message than the one of the studies I just mentioned earlier. So that's the first series of dilemmas. Secondly, there is, of course, and I already mentioned this when mentioning the McKinsey Global Institute study, there is a choice to be made between focusing on the consumer's behavior, the end of the chain interventions, if you wish, on the one hand, and addressing the structural causes of what creates an obesogenic environment. There are, of course, many advantages to adopting a whole of government approach in which all different sectoral policies will be aligned on the objective of creating health and supporting healthy diets. If I go back for a minute to this scheme you already saw, we could link all these different policies to different ministerial departments. And we could easily build an argument for an interministerial task force working towards achieving a consistent approach towards healthy diets by bringing together different ministries to improve the food environment and to ensure that greater consistency in governmental policies is achieved. Another reason why we need such a across-the-board, cross-sectoral policy in order to improve diets is because intervening in one sector will be ineffective as a result of people compensating what happens in the school, for example, with what they do in the household. Let me give you just one example of this. There was this study concerning students in Texas. These students were followed for, in total, 5 or 6 years. Their dietary choices were monitored before the cafeteria in the school changed its supply, its menus, during the change and after the change. So in total it went across 6 years, and there were different groups of students that were compared. So one was a control group, there was no intervention concerning that control group. The two other groups were either people who were going to this cafeteria that changed its menus without parents being involved, or third group, parents were also involved, so that the messages about healthy eating were also messages that reached the family, the household. And unsurprisingly, I guess, the children in the third group changed their diets in ways that were significant, when children in the second group, right, which had these healthy menus at school, but then went back at home and did not hear the same messages, had no parents involved, they simply compensated at home in eating less healthily there, right? What's perhaps more surprising is that only girls had a significant change in their behavior, not boys. I'm not sure what the explanation is that is given for this. But so that is a second important choice we have to make, whether to focus on the end of the chain, on lifestyle choices, on the individual consumer, or whether we need to address the structural causes in a cross-sectoral fashion. And you, of course, can see where my preferences lie. Now, thirdly, and perhaps more importantly, there is a difference between interventions that, to speak a bit provocatively, treat people as objects, as if they could be manipulated from the outside, or interventions that treat individuals as actors who can make choices that can be sustained across time, provided they are supported in making these choices. Let me take as departure point a theory that was developed by social psychologists Richard Ryan and Edward Deci from Rochester University originally, and that was applied in a number of areas, including the fight against obesity. What they show, in a nutshell, is that behaviors that are consistent across time, that people maintain despite changes in the environment, in the economic incentives, or even in legal regulations, are choices that people make freely because they have a sense of autonomy. Choices that they make, that they believe can make a difference because they believe they have a competence to change things, they are able to change things, and choices they make because by making these choices they can belong to a group they relate to, right? So autonomy, competence, and relatedness are the three factors that lead people to develop a willingness, a volition, a motivation, an engagement that will allow their choices to persist across time, right? Even if the prices of vegetables go up, they will continue to eat vegetables. And even if the prices of soda drinks go down, they will continue to avoid these drinks because they've internalized the motivation of eating healthily, and so they are much more robust in the choices that they make. Now, Ryan and Deci are not the only ones who've been developing this kind of approach. I should mention also the planned behavior theory of Martin Fishbein and Icek Alston. Basically, what the message of these psychologists is that the behaviors that will be persistent in time are behaviors that are explicitly adopted based on people developing a conviction, an attitude, and believing in norms to which they believe they wish to adhere. So it's the exact opposite of behavior that are manipulated from the outside without the people knowing, right? And it basically sends the message that we need to be conscious individuals, aware individuals, because otherwise our changes in behavior will be extremely fragile and can change as soon as the environment evolves. Again, another author that moves in this direction is Brian Wansink, who introduced the notion of mindless eating, the idea being that one major cause of obesity is people eat without thinking as to what they eat and how they eat, right? Like in this picture of someone watching TV while eating a pizza, he would eat much more because not being connected to the food that is eaten and without being conscious about making these choices. So I believe that one major debate we have to have is between these nudges that try to influence people unknowingly on the one hand, and investing in making people more autonomous, more responsible, more aware of the importance of the choices that they have to make so that these choices can persist across time and, if the environment changes, nevertheless be continued. Now, a fourth question I'd like to raise is whether we should not move beyond treating eaters as consumers and treat them instead as citizens. And in the debates on the right to food, as many of you know, there is now a strong push for food democracy and for various social innovations that allow people to recapture control over the food environment by democratizing decision making on how food systems should evolve. Why does this matter? Does this relate at all to the various legal interventions that can contribute to the fight against obesity? Well, let me take as first example of why this may matter the very problematic way in which people's choices as to which foods they should consume are influenced by advertising. This is an advertising campaign that is, I think, fantastic. It opposes broccoli to kale, just like Coca-Cola was opposed to Pepsi-Cola, for the benefit of both, of course. And it is a way to make broccoli and kale fun, cool, and make it trendy, in particular amongst the youth, right? By slogans that are tailored to their purpose. The only problem with this campaign is it never was led. There's no one to pay for it, right? Because no one would be willing to invest the millions of dollars invested by Coca-Cola or Pepsi for non-processed foods that have very little added value and to which no brand is attached, right? And in general, there is a complete imbalance between advertising campaigns by food processors that sell the wrong things, most of the advertising money of which goes to confectionery, to soft drinks, and to snacks, on the one hand, and on the other hand, campaigns for healthy eating. Right? And in fact, the campaigns that have been studied for their effectiveness, for example, the EU campaign, Tasty Bunch, or the Manger Bouger campaign in France, or the campaign in the Flanders in Belgium, Goed in je vel, well in your skin, dat voelt beter, that feels better. These campaigns have been of limited effectiveness. And one reason for this is that, contrary to what one might have hoped, there is a very poor connection between the knowledge we acquire about food and food preferences. One would think we are rational beings and that well informed about the benefits of healthy eating, we therefore eat healthily. Not so. And the study here, experimental evidence on the impact of food advertising on children's knowledge about and preferences for healthful food, is actually a study on the impact of advertising on children's eating behavior. But in fact, it also has a discussion on the effectiveness of public campaigns for healthy eating. And the result is they are useless. Because the reasons why we choose certain foods, or I should say more precisely, enjoy certain meals, has nothing or very little to do with our, if you wish, abstract knowledge about good nutrition. Quite distressingly. So we respond to routines, we respond to social pressure, we respond to irrational factors that guide our consumption and our eating habits, not to what we know would be best. Right? So maybe one reason for this is because we've not produced this knowledge. It's knowledge that is imposed on us from outside and from above. And it's striking that when we study the eating behaviors of those involved in food systems reform, right? So people like you, they change their diets much more significantly than the millions of targets of these advertising campaigns. This was a study on community-supported agricultural programs in Kentucky. Some 150 families relying on CSA schemes were monitored, were surveyed to assess how they changed their diets. And of course, comparison was made between their diets before joining the CSA scheme and after and so on. And it's extremely impressive to see how having a few vegetables per week in a basket, right, from your local farmer significantly changes people's diets far beyond those vegetables being consumed. Why? Well, people become interested in nutrition issues they may have not cared much about before. They learn how to cook, or I should say they relearn how to cook. They learn about new vegetables and how tasty they can be. They have discussions at the family table about what eating healthily might possibly mean, and it has community-wide impacts to introduce a CSA scheme in a particular neighborhood. So, and the model used is very close to that of Fishbein and Aishan I mentioned earlier. It's called the information, motivation, behavioral skills model to understand how people change their behavior. And we have a similar study, I don't have time to describe it, but a similar study on community gardens showing how people participating in these gardens actually change their diets much more significantly than those who are simply targeted by campaigns in which they are not made active participants. What this means is we may need to involve people in changes so that they can become actors, participants in reshaping food systems, and that is probably the most effective legal intervention we can imagine. This last study is one I will not discuss now, but we could refer to it later. So my conclusion is that we should not underestimate, as part of the set of legal interventions that should be discussed and perhaps promoted, beyond the 74 listed by the McKinsey Global Institute study that target the consumer, that try to change the set of incentives for the consumer, that try to educate people about health or try to nudge them into making the right choices. We should not underestimate the need to regain control over food systems. And this is the direction in which we are moving. On 15th of October last year, there was a signing in Milan, in this beautiful palace, of the Milan Pact on Urban Food Policies, pioneered by the mayor of Milan. And this event brought together some 150 mayors from different cities of different world regions who signed this Urban Food Policy Pact, making a number of commitments to develop sustainable food policies at city level by a cross-sectoral approach, by involving people for the benefit of public health in these cities. One example out of many others that could be mentioned, but this is an example from the UK that is particularly interesting, is Bristol. Bristol that developed a good food plan that has a number of components concerning land use, concerning the retailers being incentivized to sell the right things, concerning schools, of course, local food markets and farmers markets and so on. A whole of government approach, if you wish, at the level of the city of Bristol to encourage people to have healthy diets. And that is developed in a very participatory fashion so that all people in Bristol have had their say in how this good food plan is being shaped. That kind of intervention, it seems to me, is far more lasting in its impact, far more promising, and much more fun than interventions that are either taxing people, imposing on them certain behaviors, or trying to manipulate their choices unknowingly. And indeed, it is in this direction that the Global Convention to Protect and Promote Healthy Diets is going. And I look forward to the presentation by Tim Lobstein, the main author of this proposal of this instrument, which I myself try to promote as much as I can. I think almost as much as you, because you are too modest, so you don't dare to promote it as much as it is worth. But it's a terrific set of proposals that is interesting because, first of all, it lists the range of tools that are at the disposal of governments, very explicitly adopting a whole of government approach, as I've mentioned earlier, and not limiting itself to one isolated intervention, which in isolation will have a very limited impact, if any at all. It also is interesting because it imposes on governments to be held accountable for respecting the time frame they've adopted and implementing the action plan that they decide to adopt. Crucially, it insists on the participation of beneficiaries, saying that strategies for healthy diets should be shaped with the involvement of various stakeholders so that the strategy is owned by those whose behavior it is meant to influence and who are meant to become participants in the implementation of the strategy. So for all these reasons, I think this was only one way to introduce what later we shall hear from Tim. Thank you.